So our initial questioning process is called our Opti-Chem Blood analysis. And this includes a lot of the standard labs that you have, and that's why we ask you to get us your labs before you come into our office so that we aren't reproducing tests, so we have an idea of like what kind of diagnostics. Now, this first line right here, the CBC with differential, CMP14, and lipid panel, I'll go into what that all means. CBC is complete blood count. But let me first say, I review records all the time, and what I see over and over, and even with like really odd, difficult, serious conditions, this is the lab panel that they run over and over. So I'll see like, okay, 2004, they ran a CBC with differential CMP14 and lab lipid panel. They decided to use a drug. Next year, the patient comes back in and has the same complaints. And so they run a CBC with differential, a CMP14, and a lipid panel. I might see 3, 4, 5, over the course of years, the same panel, the same question being asked over and over by their physician, who are, I don't know, ignorant to the other questions, unwilling to ask deeper questions. They don't ask the questions because they don't know what to do with the answers. I'm not sure what it is, but this is what I see most people coming in with. So unfortunately, this test is probably about $15, and a lot of the information that we need has to be derived from this point forward, but we'll see. I do see some labs where they look at other inflammatory, look at some of the thyroid markers, some of the minerals and things like that. Some doctors are doing the vitamin D, but let's go through this step by step. So the CBC with differential is your white blood count, and so this is your immune system. And the differential is the neutrophils, which are more specific to bacterial infection, lymphocytes, more specific to viral infections, monocytes, eosinophils, basophils. They're different types of white blood cells that react to different types of stressors and immune stressors. The CMP14 is the panel that gives you like the LDH, which is monitored during a heart attack. So when the LDH, back up, when the heart is injured by a clot and a loss of blood flow to an area of the heart muscle, damage to those cells occurs very rapidly, and those cells release a chemical called LDH. It's an enzyme, and it's indicating that the cells in your heart are dying very rapidly. So it's good to have. We want to know, are your liver cells, are your kidney cells, are your heart, bone, are they dying faster than they're reproducing, replenishing, healing? The lipid panel gives us a lot of good information. I'm not a person who likes to crush your cholesterol down to nothing, hoping that that's going to prevent like a heart attack. We need cholesterol to produce our hormones, and so we want balance here. We don't want to just, push it down to nothing. But it gives us, how you're doing with your insulin, how your liver is functioning, gallbladder, because that's where cholesterol and fats are digested mostly. So we get a lot of good information from the lipid panel, including a triglyceride to HDL ratio, which is probably one of the best markers for how you're doing with your insulin. And then we get a straight blood sugar. We also get blood protein, so we have sugar, protein, and fat. That's the macronutrients in your body. And we'll see how you're digesting them. We'll see the levels, if they're in balance, those kind of things. I think everybody should get the inflammation markers. That's homocysteine, high sensitivity C-reactive protein, and erythrocyte sedimentation rate. These are just lab markers for inflammation. Now don't shut off your brain because you hear some terms that you don't understand. You know this term, inflammation. These are the markers that we use to get that. Thyroid and pituitary panels. A lot of times we'll see on records that you do get a TSH. And this is how medicine works. They do a TSH. If it's too high, they give you thyroid hormone, Synthroid, or something like that. This is how it actually works. TSH is a pituitary hormone, and it tells your thyroid what to produce. T4 is that production. It's a measurement of that production. Now, the actual hormone that your body uses is the T3, and that reflects what's going on in your liver. It's converted mainly in your liver to T3. So we have to have pituitary, thyroid. How is it converting into T3? We've got to have all that. And that actually sets your metabolic rate. So energy production, blood sugar regulation is intimately tied into that. So we get a good glimpse. We'll also see other hormone things that kick in. For instance, a high estrogen would alter the ratio of your T4 to T3. So we'd get a clue that we need to look deeper into some of the steroid hormones, which aren't as easy to get on, and I'll explain that in a minute. They're not as easy to get on a single blood test. We also get the minerals: magnesium, calcium, potassium, sodium, iron, phosphorus, chloride. We also add on ferritin usually, which is another form of iron. One thing of interest here for more clues moving forward into greater diagnostics is that sodium and potassium ratio. That's a function of the kidneys. What are the kidneys getting rid of? Are they getting rid of sodium? Then, well, if they are, they're getting rid of water too. But what tells the kidneys what to do? And that's your adrenal glands. It's a hormone issue. So that's a clue. Like if your sodium potassium ratios are off, you might want to ask what's going on with your adrenal hormones. So further diagnostics. We also get a vitamin D because it's so key. It's turned up that it is deficient in so many people. It's so key to immune system, bone metabolism, everything. You know, it has a lot of functions in our body. And another important point is that we look at functional ranges, which are your optimal ranges. So when you get a lab back, let's say your vitamin D, the lab will give you a range that it marks as a disease range. Okay, so this level is associated with the disease. There's also an optimal level. So like a really healthy person would have a certain level of vitamin D. And functional refers to the space between optimal and disease, which is like dysfunctional. You're not diseased yet, but you're dysfunctional. You may not feel well, you may not function well, because you're not in your optimal ranges. So by looking at optimal ranges, we pick up a ton more information diagnostically. We get much deeper level of understanding about what's going on in your internal environment.